Today we're going to learn about some of the steps of venipuncture. We're going to talk about identifying the patient, and we're going to talk about positioning the patient and applying the tourniquet. Venipuncture means a collection of blood from a vein. So let's get started. The first thing that we're going to do is always, and the most important, is to identify the patient. You want to ask them their full name and birthday. You want to make sure that you do this because proper identification is essential to avoid collecting a specimen from the wrong patient. And the next thing I like to do is while I'm washing my hands, I'll introduce myself and make sure that they understand and are aware of the tests that are going to be performed that day on the blood that we're collecting. Venipuncture can be frightening, and you have to make sure that your patient is comfortable. I always ask if they do okay with blood draws, if they tend to feel a little lightheaded, and if that's the case, then you want to position them in a chair that can recline a little bit. So all the while that you're getting your supplies ready and you're getting everything prepared, you're going to want to be talking to the patient, making sure to make them feel as comfortable as you can. Proper positioning is important to allow easy access to the vein. So we're going to go ahead now and bring in a patient, and I'll show you the proper positioning. Alright, so as I mentioned, proper positioning is important to allow easy access to the vein. The patient should be seated comfortably in a chair. The arm should be extended downward to form a straight line from the shoulder to the wrist with the palm facing up. The arm should not bend at the elbow. A lot of times you can ask the patient if they'll just put their hand in a fist underneath their elbow to hold it up. That's helpful. You could ask, the patient's position depends on the vein being used, obviously, as well. So now you're prepared to select a site for venipuncture. For most patients, the best site is the antecubital fossa, which is where the arm bends at the elbow. The vein of choice is the median cubital vein. In this diagram here, you can see, let's see, I'll hold it right here. You can see that we've got the cephalic vein that's coming right along here. You have the basilic vein, and this right across here would be the median cubital vein, and this is the one that is the best. And the reason is because it doesn't tend to roll. If you're going to use the cephalic, it's fine, but you want to make sure that you anchor the vein really well, because otherwise it can roll. An important step in venipuncture is the application of the tourniquet. The tourniquet makes the patient's veins stand out so that they're easier to palpate. The tourniquet acts as a dam, which causes the blood to slow down and pull in the veins in front of the tourniquet. This pulling of blood makes the veins more prominent so that they're more visible and can be palpated. This is also why it's important to remove the tourniquet before you remove the needle when you've collected the blood. If you remove the needle first, the pulled blood will force out of the puncture site and result in a hematoma. The most common tourniquet is a soft band of rubber approximately 1 inch wide. I'll walk through the steps and demonstrate how to apply a tourniquet before I have you pair up to practice. So first of all, you're going to hold each of the tourniquet ends with one hand. You're going to position the tourniquet about 4 to 5 inches above the crease in the elbow. You're going to make sure the tourniquet lies flat against the patient's skin. Create tension by pulling the ends of the tourniquet away from each other. With tension, you're going to cross over the other at the point of your grasp so the tourniquet is snug but not pinching the patient's skin. Then you're going to form a loop by tucking a portion of the tourniquet underneath. This allows for one hand release of the tourniquet when you've completed. And you want to make sure that the ends of the loops are facing up and away from this area here where you're going to be doing the venipuncture. Yeah, it's recorded. Okay guys, so now that you've observed some of the steps towards venipuncture, I'm going to ask you a few questions, okay? True or false? You should always use the patient's right arm for venipuncture.
False. You
Okay.
can use either arm or sometimes the wrists and even possibly the feet.
Okay. What about the underside of the wrist? Can you use the underside of the wrist?
No.
No. Okay, perfect. Thank you. All right, true or false? Always remove the tourniquet before removing the needle from the patient's arm.
True.
Okay. And why is that, do you think?
So that you don't bruise the arm and that blood doesn't go everywhere.
Okay, thank you. Good job so far, guys. Okay, let's see. How far above the venipuncture site should the tourniquet be applied?
4 to 5 inches.
Good job. Perfect. All right. And why do we do the tourniquet in the first place? Does anybody have any ideas on that? We're doing it 4 to 5 inches above the site. Why do we have it there?
Is it for blood flow?
Yeah, we're trying to kind of stop the blood flow. We're trying to get to pool the blood so that the veins will pop up a little bit more and we'll be able to palpate them a little bit better so that we can get that needle in where we need to draw the blood. Okay, and how long is it okay to keep the tourniquet on?
1 minute.
You are right.
1 full minute.
Good job. Okay. And what is the very first thing that we do when performing venipuncture? It's kind of a trick question. Who can think of it? The very first thing you do.
Identify the patient.
Perfect. Thank you, Claire. That's awesome. Perfect answer. Okay, so now what we're going to do is we're going to team up. And I'm going to let you, well, we're not going to team up because we only have 3 of us here. So we're going to, so Ben, you and Claire are going to show us how to apply a tourniquet, okay? So I'm going to, have you ever done this before? So just from what you've seen and learned, okay. Okay, so what you're going to do is you're going to hold each end of the tourniquet. Then you're going to have your arm facing her on the table. Okay. All right, then you're going to put the tourniquet underneath. Perfect. So you're going to position the tourniquet 4 to 5 inches above the bend in the elbow. Make sure that the tourniquet lies flat against his skin. Now you're going to create tension and pull him both to the sides. Out like that, perfect. Creating the tension. With tension, cross over the other one. And at the point of right there where it's crossing, you're going to use your thumb and you're going to push and form a loop between the tourniquet and the patient's arm. Coming from the top. You're so cute. Okay, I'm going to come over and help you, and then I'll have you try again. Okay.
Sorry, I'll get more.
That's okay.
Tension.
Perfect. Good job. Now release it. Awesome. That was great. Okay, Ben, do you want to try it on Claire?
Sure.
Okay. Good job. You guys are awesome. Okay, let it go. And do you want to try it? Keenan, do you want to try it on Ben?
Sure.
Okay. Good job. You guys are quick. Awesome. That is great. Well, thanks, you guys. I hope that you've learned a little bit about how to do some of the steps before venipuncture, to greeting the patient, identifying the patient, the positioning, and then also applying a tourniquet. So we're done.
Thank you.